Chapman, and I've been coming to this memorial for just over 2 years, since my brother Brad died and was almost a John Doe, but is he's listed here on the memorial. So in July of this year, we started to see that there were a number of overdose deaths, and we decided to do something about it. So we set up some tents, we pitched some tents in Moss Park on August 12th. And I'm proud to say that we're still there. I'm glad we're not into it. We now have a heated trailer that's there. We have hydro. And it's almost 5 months now that we've been there. To date, we've seen almost 4,000 people. We've had 3,855 people in our supervised injection service, and we've reversed 143 overdoses.
Wow.
So in the past 2 weeks alone, amidst these record-breaking freezing temperatures that we've had 356 visits to our injection services, and we've reversed 14 overdoses. So we continue to be a vital resource for people who are using drugs. We were Ontario's first overdose prevention site, and in fact we sort of opened the site because we couldn't wait for the construction for the sanctioned sites to open, the legal sites. And in us opening, Toronto Public Health actually opened 10 days after. So we prompted further action from the city. Their construction was supposed to be for several months, and they weren't slated to open until the fall. So we're very proud of that accomplishment. We just want to talk about as well, many of the people who visit our site are homeless. And so Tave's just going to talk about some of the issues that they tell us about.
Hi, my name's Tave, and I've been working at the site just since October. Lots of the folks who come and access our service are homeless, and as I'm sure many of you are aware, the warming centers and the emergency respites that have opened are not really an adequate solution. People are reporting unsafe and unsanitary conditions there, like a mat on a cold floor or like a cot in a gymnasium with the lights on all night isn't a place to get some restful sleep. So people don't access those services for a number of reasons, and those are just a few of the ones that we've heard about. Molly's going to share with you some demands that we wish to make in response to the homelessness crisis, which we can't really separate from the crisis of overdoses that is happening.
Thanks everyone for being here. My name is Molly. I'm here with Toronto Overdose Prevention Society, like these guys, and we're really here because there's so many people dying of overdose, and there's so many people dying of homelessness, and we know that those are tied together, and we know that they're the result of government decisions. And I can't help but be here and think about the number of people that I have known living on the streets who have frozen to death, who have committed suicide, who have overdosed, after being released from hospitals, after being discharged from jails or from treatment facilities, and knowing that it's really our collective humanity that's failing, and also our government policies that are failing on all levels. And we're here today to stand with OCAP, to stand with folks from Inner City Health and from community health centers to say that we need to do better, we need to do more together, and we need to know that our shelters will be at a capacity of no more than 90%, so that people have no troubles to get into shelters and can have choices and options about where they feel safe and where they can go. We need an income, social assistance is income that can sustain people to pay for rent, to have homes where they feel safe, where people can use safely. We know that housing is one of the first steps in harm reduction and keeping people who are using alive. We know that we need health care that works with and beside people who use drugs, people who are struggling with mental health realities, and people who are struggling with the systemic exclusion that we're seeing people face every single day. So we're here to stand with OCAP. We're here to ask that by April 15th at a bare minimum, that we see at least 1,000 beds opening to manage the number of closures of warming centers and respite centers that have opened in this crisis. We need more housing. We need housing where people can stay, where people who use drugs can stay downtown, where their community are, where their services are, and where their friends and their loved ones and their street family are, and that they can be together. We're grateful for OCAP, for the work of Kathy Crow, and so many people who are doing this work and coming together, and we need more.
So just one final demand is that we also know that Toronto Public Health started tracking homeless deaths as of January 1st of last year. We know that they're corroborating their death count with the coroner's provincial data, and we ask that the Toronto Public Health release the number of homeless deaths that are attributable to overdose. We need this information. This will help to plan services not just for activists like us, but we're also professionals, but also for municipalities to be able to effectively plan services to reduce homeless deaths in general, but also to reduce deaths attributable to overdose. It can't just be a matter of counting bodies. We need to be able to act.